We're going to be moving on to our second segment, which is focusing on the insights that we had from one of our events on mental health in diabetes. We had the fantastic Dr. Peter Perry with us as the presenter. But Joan, what really stuck with you about that event? I've got a few things that come to my mind, but from your perspective, what did you remember afterwards when you're thinking about this event?
Well, I was really glad that we did this event, Bernadette, because I think it was so important to highlight how critical your mind health is, your mental health is, to living with diabetes and also being at risk of developing type 2 diabetes. So I thought it was really good that we did it. The things that stuck with me was non-judgmental questions to your loved one, your family member, your friend, and also being non-judgmental if you're that person who may be living with diabetes or at risk of developing diabetes, and you are undergoing some sort of treatment like cognitive behavioral therapy, that you keep an open mind to examine your beliefs in a non-judgmental way, sort of fixed way, being open to other possibilities, so that can then help you to see how your behaviours might be changed to enable you to live a healthier life.
Many of those also stuck with me. I thought when he mentioned about how difficult it would be for someone living with diabetes if everything that they ate in front of people who knew they had diabetes was criticized, how that might slowly impact a person's mental health, and how to best approach asking those questions that you mentioned, Joan, and Eloise mentioned earlier. It's not judging people if they would like to have some cake because they're living with diabetes, but maybe supporting the person in a better way, asking open questions in a non-judgmental way. So that was brilliant. And for those people in the audience who didn't make the event or weren't able to attend, or people who attended who would like to see it again, you can watch a recording of that event on our YouTube channel. We'll put the details of how to access that at the end of the event. We'll put that in the chat. I guess the question to you, Joan, is in what way has mental health been a red thread throughout our previous 9 events?
As I say, I think it was so important that we highlighted mental health. Mental health, and let's call it well-being as well. Not just in this webinar, but we touched on mental health actually pretty much in every event in this series, because as food is fundamental, mental health, as you said, is integral, it's critical to somebody who is either living with a condition or at risk of developing it. That may affect the way the person engages with treatment management, or it may be in terms of the way the person makes choices about the foods that they're eating or the activity that they're doing. So, it can impact somebody living with diabetes or at risk of developing diabetes in many different ways. So it's really important that we keep our health, and that's our general health, physical and mental, as well as possible.
Absolutely, I completely agree with all the points that you mentioned there. Many hashtag what stuck with me's in that description for sure, Joan. Moving on to our next bulk of events, where we talk about some of the complications that can occur for people living with diabetes. We had an excellent event on eye care with Miss Evelyn Mensah. We had diabetes and erectile dysfunction with Prof. Frank Chinegwendu. And we also had foot health with fantastic Dr. Chris Manu. So why, for me, why are we talking about complications? We know the importance of prevention. We've talked about that. Food, lifestyle, the way we interact with our cuisine. We know that's important. We've touched upon mental health. However, There are instances where people have had some challenges with their diabetes over time, and it's important that people know about what the um, complications of diabetes are, and once people have them, what they can do to have the best outcomes. So, as we did previously, we're going to move into a few clips from 3 of the events that we had as part of the Diabetes Health Matters series. Um, in the foot care clip, we'll give a brief warning before. The images are quite graphic. We think it's important that they're in there so that people do have an understanding of what it can look like if somebody has very severe complications. But we are aware, especially because of the time of our events, that it might not be what people would like to see. So please feel free to look away from the screen when we have the warning. But we are going to touch upon some of the complications of diabetes and the way that things could be avoided or things to look out for. So let's roll the clips.
Well, talking to our patients, everybody who knows me, I love talking to my patients. I love hearing their stories. I love it. I really enjoy my clinics, and I like hearing about what's going on. And this patient particularly, I really, really enjoyed. So she came along. She was one of my patients from Ghana. This is what she looked like on the left. All right. And I said to her, there's just too much fatty deposit here. Do you think perhaps if you could increase your exercise levels and maybe rather than frying the fish or frying that chicken, maybe grill it, reduce your oil intake? And lo and behold, 3 months later, things were getting less. So it does work. Just that change in lifestyle, modifying one's diet, modifying your lifestyle, just increasing the level of exercise can have a significant impact, and it can actually save your sight.
And just to round off, to re-emphasize the importance of communication, both with your partner and with your healthcare professional. Erectile dysfunction is very common in men, and it's even more common in men with diabetes. And you're not alone. There'll be many, many, many others, even though other men may not share what's going on in their lives. So don't be shy. Seek help, and the earlier you seek help, the better.
So this is a picture of a lady. Again, you could tell how she's painted her nails nicely. There was supposed to have been an x-ray on here, but if you were to see the x-ray of this toe is completely necrotic on the inside, and she had to have the toe amputated. But you could tell that, yes, she's painted her nails, completely oblivious about how severe the infection in that foot is. And if you look at the sole, the part of the foot, again, this will not be classified as erythema. But that toe is completely devitalized. There's no blood in that toe there. That's why it is white. But a clinician or someone will be looking for, okay, I'm looking for erythema, I'm looking for redness, I'm looking for warmth. But this toe is completely dead. And it's completely devitalized. There's no blood in that foot. That's why it is looking that white. It should be looking like that color there. If these patients are picked early enough, it's not all doom and gloom. So these are patients with quite a severe ankle infection, going quite deep to the bone. And in most places, she will have lost her leg. But having surgery, a very, very deep, aggressive surgery to remove all the infection in the bone in the ankle, he then has a vacuum dressing or aggressive wound care with vacuum dressing to get it feel up. And that's the same foot there, and it heals up. So it is not all doom and gloom. If we pick up these cases early, if they are referred to the right team, the right specialist, and people receive aggressive treatment, the limb can be salvaged.
It was great looking over those clips. I thoroughly enjoyed. Yes, some of the visuals were a little bit graphic, but I really think that firstly, it's good to see that. And then second of all, the message from each of the speakers was incredibly clear. With early intervention and detection and proper treatment, we can avoid people getting to that stage. Or if they've gotten to that stage, here's what we can do to minimize the risk. That really stuck with me. And I think there's sometimes people can feel disheartened when they do have complications because there are significant challenges. But Joan, something you've mentioned throughout the series, it's never too late. And if it's not about prevention, it's about how can we stop any progression. Do you want to touch upon that in light of the clips that we've seen from our speakers?
Ask on a regular basis, make it routine, make it regular. So don't make it something special in a way. So at every contact, and that can be not just, the specialist, every contact with a healthcare professional who is looking after with you, your diabetes, make it routine. So always ask about erectile dysfunction to men. Always ask about eyes, feet to everyone who is living with diabetes, and be sure that people understand why you're asking and the importance of why you're asking. Make it routine.
Great tips, Joan. And to compound onto those, we have another quiz for you in the audience. This time, we're going to be talking about the complications, asking you a few questions related to that. You'll have a screen pop up with the question. Please vote, and then we'll give some comments on the correct answer for that. We've done this many times before, looking forward to kicking off. So the first one taken from our event with Prof. Chinagwendo. So throughout their lifetime, how many men living with diabetes would experience erectile dysfunction? So you've got 10%, 20%, and 50%. So keep voting. I think this was an interesting one. We were contemplating whether to run the event because of the topic, but I'm so glad that we did, and we had positive feedback about it. It's a very important topic for everybody. I'm going to end the poll. We see majority of people said 50%. Joan, any quick comments?
Yeah, just that there's still knowledge to share. So 50% is the correct answer, but there was a few people there who still weren't aware of that.
Right, moving on to eye care. We've got, for people living with diabetes, eye examination should be carried out how often? Every 6 months, every year, only when symptoms occur. So you've got a little bit of time to vote here. Let me share the results. A close one.
Okay, I suppose if we clarify and say in the UK, and as we say as a routine, then it would be every year. Every year would be the correct answer. So just to be absolutely sure, in the UK, as a routine, so certainly not when symptoms are occurring, that's an emergency. This is for your routine annual review every year.
Brilliant. Now, moving on to the next question. This is about foot complications. So people suffering from diabetic foot complications have a higher 5-year mortality rate than people living with breast cancer. Please continue to vote. I thought the foot event was fantastic. Quite graphic, was hard to take, but I think it's important for people to see what diabetic foot complications look like. So I'm really honored that we were able to have that event. To share the results, Joan, do you want to take it away?
Yeah, absolutely. So it is true, unfortunately, and sadly, it is true. So 77% of people this evening are getting that correct. But please, if you didn't see that foot webinar, go and watch it. It's well worth watching.
Moving on to the next segment that we're going to be talking about. It's women's health, and we're going to have a little bit of information on Joan on one of her famous phrases, each one, teach one. Before we go into that, we're going to focus in on diabetes and pregnancy, which was the 9th event in the Diabetes Health Matters series. It was hosted by Dr. Joan St John, as with the rest of the series, but our speaker was the fantastic Dr. Buji Akinshola.
So lifestyle. It's all about managing diet, managing weight, keeping active, having regular monitoring. Certainly, following delivery, women should have a blood glucose level checked. This can be a fasting plasma glucose or an HbA1c. And the targets or the diagnostic targets will be very similar for people that have that aren't pregnant. It's important that if diabetes is obviously diagnosed, this needs to be confirmed. And if it's in one of the intermediate ranges, then these women do need to be closely monitored and offered usually annual testing for diabetes. It's really important that if they're planning any subsequent pregnancy, they should be checked for diabetes prior to becoming pregnant and offered an early glucose tolerance test during the early stages of pregnancy, so that if they have developed pre-existing diabetes prior to becoming pregnant, that can be picked up early, they can start monitoring and be commenced on appropriate medications.
Some insightful bits of information shared there by Dr. Akinshola. Joan, for you, what stuck out to you?
Well, I think the lifestyle, because, it's like a continuum, isn't it? Okay, we're talking about diabetes and pregnancy, but this could have been actually in the first event, that same sort of advice, lifestyle. So with somebody who has diabetes and is pregnant, whether they're living with diabetes beforehand or developed diabetes as a consequence of the pregnancy, when you've had the baby, it's important to ensure that you adopt that healthier lifestyle. Of course, during the pregnancy as well, but when you've had the baby, if it's something you developed, type 2 diabetes, during pregnancy, it's really important that you follow that up now for the rest of your life, that you need to have those blood tests done, that you need to be mindful of having that healthier lifestyle, that you need to adopt that healthier lifestyle and those patterns. And the other thing I would say, Bernadette, which is really important for me, is that it's not just for you, it's for you and your family. So it's really important that you adopt the healthier lifestyle, but then you can spread that healthier lifestyle with your family.
Like you said, Joan, it is about the individual, the woman in the pregnancy, and also the health of the child. So really important. I really like it. Lifestyle. Easier said than done, but yes. A fantastic event in any case. Also, for people who weren't able to make that event or would like to watch it again, it is also available on our YouTube channel, which we will share the link to at the end of the event. Moving on to each one, teach one. So Joan, I feel like at the end of this, we should have t-shirts available. One that says prevention, and then we should definitely have each one, teach one. Tell us what that is about and how people can do it.
We've been able to showcase, highlight spectacular experts, within this field. Now, they have the knowledge, they've had the knowledge for quite some time, but that hasn't been shared with the wider community, healthcare professionals and people living with diabetes. So for me, it's about spreading knowledge, spreading information, spreading awareness, and eventually having a healthier population. So it can almost encompass the prevention, because if we're healthier, more aware, more knowledgeable, it may be that we will be able to prevent some of these conditions, prevent the conditions getting worse, certainly. So yes, it's a motto I like to live out. I try and share whatever knowledge I have gained with as many people as possible. And our wonderful experts have also done that throughout the series.
We have had feedback from people saying how this has either helped them make a change in their practice if they're a healthcare professional, or also made them more aware of just the all that's involved in diabetes health. So it's been a pleasure to work with you on this series, Joan. Diabetes Oprah, as we have renamed you. But it's been a pleasure. And I mean, before we go into the Q&A session, are there any words, anything you'd like to share about the series or the work that you've done, and maybe a bit about what this type of work means to you?
I hope, although this is the finale of season 1, it won't be the final finale, and that we'll be able to come back, because there are so many other topics that we really need to highlight and raise awareness of. So never give up hope is what I would say. If you can, try to be healthier, because for most of us, there's always something that we could do. And protect your well-being. So that may be another word for mental health, but protect it, look after it, nurture it, because that is underpinning everything else.
Couldn't agree more. It has been a pleasure. I hope we can do more of these. But before we do the final roundup of the series, which sounds strange to say, actually, it's been a fantastic journey. We're going to move on to answer some of the questions that we received when people were registering, and also some of the questions that have popped up in the chat.